If you are dealing with urinary symptoms caused by an enlarged prostate, there is a good chance you have heard about two commonly prescribed medications, Cialis, also known as Tadalafil, and Flomax, also known as Tamsulosin. These medications are often prescribed to treat symptoms related to benign prostatic hyperplasia, commonly called BCH. Many men ask the same question: which one is better? The answer is not always simple, because the best medication depends on several factors including your symptoms, your overall health, your lifestyle, and sometimes even your budget. In this video, we will break down how each medication works, what patients typically experience, the side effects you should know about, and when one medication might be a better choice than the other. Let's start with Tamsulosin, widely known by its brand name Flomax. This medication is one of the most commonly prescribed treatments for urinary symptoms caused by an enlarged prostate, and many doctors prefer it because it tends to work quickly. In many cases, men notice improvement in their urine flow within just a few days. They may find that their stream becomes stronger, the urgency decreases, and they are not waking up as often during the night to use the bathroom. Tamsulosin works by relaxing the smooth muscles in the prostate and the bladder neck. When those muscles relax, the urinary passage opens more easily, allowing urine to flow more freely. For men who have been struggling with weak stream or difficulty starting urination, this can make a noticeable difference in a relatively short period of time. However, like any medication, Tamsulosin can come with side effects. One of the most common is dizziness, especially when standing up quickly. This happens because the medication can slightly lower blood pressure, leading to a condition called orthostatic hypotension. When blood pressure drops suddenly as you stand up, you may feel lightheaded or unsteady for a moment. For many people, this is mild and manageable, but for older adults or people already taking blood pressure medications, it can increase the risk of falls. Another side effect that sometimes surprises men is a change in ejaculation known as retrograde ejaculation. In this situation, semen travels backward into the bladder instead of leaving the body during ejaculation. It is not dangerous, and the semen eventually leaves the body during urination, but it can be unexpected and sometimes bothersome for patients who were not warned about it beforehand. Now let's talk about Cialis. Most people recognize Cialis as a treatment for erectile dysfunction, but what many people do not realize is that it is also approved to treat symptoms of benign prostatic hyperplasia when taken in a lower daily dose. This makes it particularly interesting for men who are dealing with both urinary symptoms and erectile dysfunction. In those cases, one medication can potentially help with two different problems at the same time. Tadalafil works differently from Tamsulosin. Instead of blocking alpha receptors, it belongs to a class of medications called PDE5 inhibitors. These medications improve blood flow and relax smooth muscle tissue in the body, including tissues around the prostate and bladder. As those muscles relax, urinary symptoms can gradually improve. One important difference between these medications is how quickly they work. While Tamsulosin often provides noticeable symptom relief within days, Tadalafil usually works more gradually. Some men may need to take it for several weeks before they feel the full improvement in urinary symptoms. However, many patients appreciate that Tadalafil can support sexual function rather than interfering with it. When it comes to side effects, Tadalafil also has its own profile. Some men experience headaches, back pain, facial flushing, mild muscle aches, or indigestion. These side effects are usually mild and often improve as the body adjusts to the medication over time. So, which medication works better for an enlarged prostate? The truth is that studies show both medications can effectively improve symptoms of benign prostatic hyperplasia. Doctors often measure symptom improvement using something called the International Prostate Symptom Score. This scoring system helps evaluate how severe a patient's urinary symptoms are. Lower scores mean fewer symptoms and better quality of life. Research has shown that both Tadalafil and Tamsulosin can significantly reduce IPS scores, meaning both treatments can help patients feel better overall. However, there are some differences. Tamsulosin tends to provide faster symptom relief, especially when weak stream or urinary urgency is the main complaint. Tadalafil, on the other hand, tends to score higher in patient satisfaction among men who are also concerned about sexual health. In real clinical practice, doctors sometimes see different responses depending on the individual patient. Some men start with Tamsulosin and love how quickly it improves their urine flow, but later stop using it because they experience dizziness or changes in ejaculation. Other men prefer Tadalafil because it provides a more balanced effect, especially if sexual performance is also an important concern. There are even situations where doctors prescribe both medications together. This combination approach can sometimes improve symptoms more effectively than either medication alone. However, combining medications can also increase the risk of low blood pressure and other side effects, so it usually requires careful monitoring by a healthcare professional. Cost can also play an important role when deciding between these medications. Generic Tamsulosin is usually very affordable and widely covered by insurance plans. Tadalafil used to be much more expensive, but the availability of generic Tadalafil has made it more accessible for many patients. Even so, depending on insurance coverage and location, Tadalafil may still be more expensive than Tamsulosin. For some patients, this financial difference can influence their decision about which medication to try first. Safety considerations are also important. For example, Tadalafil should not be used by people who take nitrate medications for heart disease, because the combination can cause a dangerous drop in blood pressure. Patients who take multiple blood pressure medications also need to discuss this carefully with their doctor. On the other hand, men who are particularly sensitive to dizziness or blood pressure changes may not tolerate Tamsulosin as well. This is why choosing the right treatment should always involve a conversation with a healthcare professional who understands your medical history and current medications. Ultimately, the decision between Tadalafil and Tamsulosin depends on your personal priorities. Some men want the fastest possible relief from urinary symptoms, even if it means dealing with certain side effects. Others prefer a medication that works more gradually but may also improve sexual function and overall quality of life. There is no single answer that works for everyone. The best medication is simply the one that fits your body, your health conditions, and your lifestyle. At the end of the day, managing an enlarged prostate is about more than just improving urine flow. It is about improving your daily life. It is about sleeping through the night without constant bathroom trips, feeling comfortable leaving the house without worrying about urgent restroom stops, and maintaining confidence in your health and well-being. Fortunately, modern medicine provides several effective treatment options, and medications like Tadalafil and Tamsulosin have helped millions of men manage their symptoms successfully. By understanding how these medications work and what to expect from them, you can make more informed decisions about your health and work with your doctor to find the treatment that works best for you.